Now that we have thoroughly reviewed the basic principles of chest ultrasound, orientation, and thoracic anatomy, we're ready to discuss evaluation of the pleural fluid. Once again, it will be important to keep a systematic approach. When assessing a pleural effusion, you should proceed with the 4 following steps: identify, characterize, quantify, and assess for thoracentesis. We have already described in the previous section how to identify a pleural effusion. A key important principle that should be followed when trying to identify a pleural effusion is to always identify the diaphragm first. Both hemidiaphragms can be well visualized on ultrasound and appear as echogenic surfaces 1 to 2 mm thick at the superior aspect of the liver and spleen. In the presence of a pleural effusion, as shown here, the diaphragm will be very easy to identify and should be visualized as a curved structure. Generally, pleural fluid will be less echogenic than the diaphragm and adjacent liver or spleen. This other sequence clearly shows the echogenic diaphragm and subdiaphragmatic liver. An anechoic pleural effusion is identified. The atelectatic lung and respiratory motion of the diaphragms are well identified. Movements of the hemidiaphragm with respiration can be readily examined, and diaphragmatic elevations or paralysis may be diagnosed with a real-time ultrasound study. A normal diaphragmatic motion is here shown in this patient with a large pleural effusion. The diaphragm will normally go down on inspiration and go up on expiration. Normal diaphragmatic movement is also seen in this other clip showing a large left pleural effusion. Diaphragmatic dysfunction or paralysis may be diagnosed with a real-time ultrasound study.